3 people die every day in Tennessee due to opioid-related overdoses, and that's according to the governor's office here in Tennessee. And unfortunately, that's just a very tiny piece of the information about this huge epidemic that we're facing. And here at 91.9 FM and APSU TV, we're working to address this issue and find out how to get to the bottom of it and see how we as a community can help to address this problem. And joining me today is Jimmy Edwards. He's the Montgomery County EMS Director, and I'm Micah Terrell. Thanks for joining us today. Now, first, Jimmy, let's talk about what opioids are for people who may not know specifically what they are. Can you give us specifics on what they are and how they work?
Sure. Opioids are either naturally occurring or they're made in a lab, and we call those synthesized. Most people understand them as being named morphine or fentanyl or heroin. And what opioids do is they attach to protein receptor sites that, more specifically, the central nervous system, your brain, your spinal cord, and your nerves. And they change the way in which our brain receives information from the body, basically blunting that or creating a euphoric, a good feeling.
Definitely. Now, fentanyl in particular, though, is really potent. Can you kind of talk about that issue as well?
Potent in reference to its weight or its volume. It is 80 to 100 times more potent than morphine, which is a very common pain medication or medication you're given for pain in hospitals and such.
And as far as the work that you do with Montgomery County EMS, you've been there quite some time and seen really a big change in how this epidemic has affected what you do, work as there in the emergency services area. Can you talk about how things have kind of transformed over that period of time, several decades, right?
So we'll roll the calendar back 36 years. The ambulances at that time had 1 or 2 single doses of 0.4 milligrams of Narcan on board. Typically, the Narcan or naloxone would expire because we didn't use it. We didn't see opioid overdoses occur, and we certainly didn't see heroin overdoses like we would be trained in school that we would see in the urban districts. What's happened now is that we have to really watch our inventory at logistics to make sure that we have enough to meet the demand. We go from having 0.4 milligrams of Narcan on the ambulance to having several milligrams of naloxone carried per truck, and then several cases of the Narcan in our inventory at logistics.
So a lot of planning, it sounds like, goes into looking at what you need. And how has your planning changed due to this epidemic?
Well, you have to plan budgetarily. You have to plan because it's not just the cost, which has significantly increased, by the way, of available Narcan, but there are other items such as bag valve masks that we ventilate patients with. If they don't have a pulse, there's a life band that we use with a special piece of equipment we have to do CPR. There are several items that we use once we arrive at the scene, depending on the acuity of the patient, that has caused a significant uptick in use, and secondly, in cost, and then I'd say thirdly, in our approach or our tactics in regard to operations that Chief Proctor will talk about.
And can you give us a rough idea of how much a dose would cost of Narcan? Because I know it sounds like you have you said cost has gone up.
Sure. So my most recent understanding of the increase in costs is back in the day, it was $1 or $2 a dose. And we are currently helping our Montgomery County Volunteer Fire Service by supplying them with naloxone and the atomizers that's used to administer it nasally. And we will spend greater than $70 per kit to prepare them for their first responder encounter.
Wow. And how many kits typically might you use in a day? I know days are not typical for you guys. I mean, you probably have very untypical days, but maybe in an average day, can you give us a rough idea?
An average, we're encountering 3 overdoses a day. And to kind of put that into perspective, if I could quote the 2018 medication naloxone administrations, the emergency medical services, the ambulances, the paramedics administered 832 times in 2018. Our first response system that we geared up in the summer, last summer, so we only had about 6 months of activity, actually administered it 168 times prior to our arrival. So that's Clarksville Police Department, Clarksville Fire and Rescue, Montgomery County Sheriff's Department, and Montgomery County Volunteer Fire Service are all first response agencies that administer naloxone or Narcan before our arrival.
And so I'm glad you brought up all those other agencies. Very much a team effort, right, for you to work closely with the volunteer fire and then the law enforcement as well. Can you speak to that as well?
Sure. Yep. Because of the uptick and because the ambulance is only as close as the ambulance is. And, while our response times are 6 to 7 minutes, there may be someone from the fire department or there may be someone from one of the law enforcement agency that's closer. So not knowing what time in which the overdose occurred, it's a very time-sensitive issue. When someone stops breathing, for every minute that passes, their chance of survival diminishes by 10%. So if it exceeds 10 minutes, outcomes are poor.
Mm-hmm. And how often typically is it? I guess it just depends, right, on where the person's at and who's closer. Because who might get first to the scene, right, might be law enforcement.
That's correct.
So.
Yeah, we've seen a significant uptick in the administration of Clarksville Fire and Rescue and Clarksville Police Department.
And as far as, again, this is a team effort, and just recently, the mayor's office has said, hey, we're going to consolidate the city opioid task force with the ASAP, to have a joint effort. Can you speak to how that joint effort helps you do what you need to do?
Sure. If all of us in the room, then we can learn from each other what we're encountering, and everyone stays situationally aware. So from the county mayor's office to the city mayor's office, Mayor Dewart or Mayor Pitts, everyone stays well informed. It as well gives us an avenue to explore other options and ideas that we may not have thought of to address the opioid crisis.
And the crisis, it seems, as you've talked about, going from one decade to the next, it seems like it just really recently has kind of just really spiked up. What in your research and just being your work, your experience, have you noticed that might have kind of led to this kind of uptick that we've seen?
Yeah, so we see both prescription opioids being abused as well as illegally acquired opioids, such as heroin of the street, fentanyl. I would have to conclude, based on our experiences, that these are people that had absolutely no intention of becoming an addict. They had no intention of and I certainly don't think that anyone wakes up in the morning and goes, well, the very first thing I'd like to do today is get addicted to something, as well as waking up in the morning and say, I think I'll overdose today. Mm-hmm. I don't think either of those things are prospects that people plan to do. But when you're exposed to something that pushes that feel-good button in your brain, and we'll just, for lack of a better term, say it pushes a button that creates a circus in your brain, and suddenly you feel better than you've ever felt before. And certainly that could be the case if you have chronic pain or chronic problems, and you attempt to match that same feel-good feeling every day. And because of the nature of the opioids, it requires more frequent dosing and higher dosing, up to that point that if you're not tolerant, then you stop breathing. And if you stop breathing long enough, then you die.
So it's typically people who just, like you said, never expected this to happen. Maybe innocently enough got a prescription and then just kept going.
Right. It would be so easy if we could teach all of the emergency services what an opioid addict looks like. But you can't,
Yeah.
because it has no socioeconomic boundary. It is someone like me that may have gone somewhere to seek treatment for back pain. Next thing you know, they're prescribing an opioid. And I happen to be one of those people that really enjoys the way that it makes me feel. It makes me feel better than I've ever felt before.
Mm-hmm.
And I get kind of attached to that, and I want to feel that good, well, every day or every minute and every moment. So, and it requires more and more opioids at higher and higher doses.
And then there's also that incident where you have people throw alcohol into the mix too. Then how does that change the equation?
Right. So we do, the majority of time it's what we refer to as a poly overdose or a poly substance abuse. Again, it is the endorphin, the receptor sites that endorphins would normally use, like a runner's high, if you've ever heard about that, is what these opioids target, and it does make you feel better. And people for hundreds of years have used alcohol in which to treat their pain.
So it definitely complicates things.
It does.
For sure. So how do you, in working again in the sort of administration field in which you're in and policy, how have you sort of tailored your policy and administration to kind of say, okay, everybody, we need to be looking out for these certain warning signs, or how do you kind of deal with that? I guess maybe watching to see whether that's an issue when you come upon a call. Obviously, then other than the bottle being there.
Right. Because you can't really say, well, this person looks like a opioid addiction patient. You have to keep all your senses readily available to you and look for the signs at the scene. We could and we do encounter this quite frequently, where we don't get the call. The call doesn't come through 911, hey, they've overdosed on heroin, or hey, they've taken too many of their pills. Call may come in that I can't wake them up, or that they're having difficulty breathing, or they have an altered level of consciousness. And then we arrive on the scene, and suddenly, we discover that, there's a needle hanging out of their arm, or we see the evidence of the pill bottles, or there's just more information, or they could there are certain specific physiologic signs that we look for.
And how have you, obviously as a medical professional, you've had to adjust the training you get and your paramedics get. How have you adjusted that over time as to deal with this?
It's all situational awareness. Every one of us were taught that Narcan is given for opioid overdoses, or it may be given if someone is unconscious, unresponsive, or in arrest, and we don't have any known etiology. We don't know why. Now it happens so frequently is that the naloxone, which once remained in the truck waiting for us is now one of those first line agents. So it changes our approach entirely.
Definitely. And as you look ahead to the future, Jimmy, what are you trying to anticipate, watching to see where that puck is going, to see where that next issue is? What are your statistics and research showing you?
Right now, it's all ticking up. The first 15 days of 2019 compared to the first 15 days of 2018. In 2018, we administered naloxone 32 times. First 15 days of 2019, 71 times. So greater than 120% uptick in administrations of Narcan. I really see our condition as one of very personal, we need a culture change. We have to change the way in which medicine is practiced, so that we don't identify those people who have a tendency to have that circus button pushed in their brain that says, hey, I need more of this feeling.
Jimmy Edwards, thank you for stopping by and speaking with us here at APSU TV and 91.9 FM. And our interview continues with Chris Proctor up in just a few minutes. Thank you. Thanks for joining us here at APSU TV and 91.9 FM. I'm Micah Terrell. We're talking about the opioid epidemic and how serious of a problem this is. And at the outset, a few minutes ago, we mentioned how, according to the governor's office, about 3 Tennesseans die every day due to some opioid-related overdose. And it's a serious problem. And we are speaking with Montgomery County EMS officials today about how serious it is for them, because obviously they're on ground zero for this epidemic. And joining me now is Chris Proctor, and he is the Assistant Chief of Operations with Montgomery County EMS. Chris, thank you for stopping by.
Thank you for having us.
No problem. Now, we talked about how serious it was earlier and everything. I want you to kind of take us through the procedure that paramedics go through when they receive word of a possible opioid overdose. Can you take us step by step?
Sure. It's always nice to have that specific information when we get dispatched to the call, so we can formulate a game plan en route, and we can get the necessary other resources en route to that call as well, because it's always a team effort when it comes to those kind of patients. But we find ourselves arriving on scenes where it necessarily didn't come across as that was the call, but we have assessed the situation and realized that we now have an opioid overdose. And then we first of all want to make sure the scene is safe for all providers, ensure that there's no needles or anybody there that could potentially cause harm to our staff and other responders. And then we allow our EMTs and paramedics to do what they've been trained to do, is proper assessment, scene survey, question those that are on scene to ensure what they're responding to or what they've arrived to. And then again, they follow protocol, procedures, they know which medications to administer, and transport to the hospital.
Now, as far as you mentioned, sometimes you might have a patient that might be, have a needle and maybe seriously almost unconscious, but you might have a patient who might be violent.
Sure.
How do you adjust to deal with that?
So if we kind of know that going into it, we always try and allow law enforcement to make sure scene's safe. If we arrive first and then we encounter a violent patient, we just try to step away, to back out, get away from the scene, notify law enforcement. We do run into that occasion quite often, and again, our paramedics and EMTs are trained to know what to do and back out of a hostile situation.
And that's good. Now, as far as protecting yourself from the actual fentanyl itself, obviously it's a very potent drug and it can cause overdoses quite easily. What sort of protection efforts do you or your paramedics do?
Yes, ma'am. So if we have the ability, we'll go ahead and we can don what we call protective equipment, PPE, personal protective equipment, and it will protect us, our skin, our clothes, from getting any kind of fentanyl dust on ourselves. We have masks, gowns, things like that. So we try very carefully to prevent any instances like that happening. However, sometimes you don't realize it, and then you're in the middle of it. So we just try to remove ourselves from the situation, get into a clean environment, decon ourselves, so we can get back available.
And as far as training goes, obviously there's some very specialized training. Can you talk about the training that the paramedics go through to be able to address these kinds of calls?
Sure. So we have a training department within our facility. Our training officers stay on top of the latest and the greatest when it comes to, response and proper medication administration. We also work with our local agencies, our drug task force, to stay up on top of recent information, recent data on the newest drugs that are out there on the street, just so we can prepare better.
Yeah, because I'm sure there are new ones coming out pretty regularly, right?
Right.
Pretty recent, yeah.
So we have to stay in touch with our other agencies to stay up on top of the most recent information.
Yeah, so you probably talk to the police department, law enforcement pretty often on what's
Most
the new
definitely.
thing that's on the street, right?
Correct, most definitely.
Now, what about counterfeit drugs versus maybe drugs that are processed maybe at an actual pharmacy or compounding facility? Do you run across a lot of illicit drugs that are just kind of homemade as well?
We probably run across that more often than we do the prescription meds. We see that they're getting smart, and they're creating new medicines constantly. So yes, we are seeing that a lot, and that's part of the education that we have to stay on top of.
Definitely.
Yes, ma'am.
Mm-hmm. Now, as far as more prescriptions than people, I noticed in 2015, it looks like we had like 118 prescriptions per 100 people. So people are getting these mostly legitimately, right? And it starts out pretty innocently and
Yes.
everything. So I guess how are you educating yourselves and learning how to do, like, okay, obviously you can find the bottle there, that's great, but what sort of training again do you do to kind of keep yourselves aware of what's what in the call?
Yeah, so we stay up on top of, like I said, prescription medicines. We want to stay educated. We take routine monthly trainings. We have online trainings, things like that we can stay updated on. And we like to try and educate the public. You know, when we're on scenes, we try to make sure they stay within their allotted dosages, make sure they know signs and symptoms of an adverse reaction when it comes to taking their own medications. So not only we try to stay educated, we try to educate the public as well.
Now, say for instance, you go to a scene and you encounter someone who may be overdosing. What if they refuse the Narcan and they say no? What's your procedure to deal with them?
So we've never really had the ability, or the opportunity, I should say, to have somebody refuse the Narcan. We've always been able to administer that without any problems. What we are finding from time to time, though, is that if we administer it on scene and before we transport, now the patients become awake and alert and oriented to the point where they can try and refuse the transport to the hospital. So what we've tried to do as a department to combat that, per se, because we believe all patients that have encountered this situation should be evaluated by an emergency room physician. So our paramedics are trained to give certain amount of dosages of the Narcan en route to the hospital. So that way, by the time we get them to the hospital, they're now able to speak, make decisions, things like that. And now they're already in the hospital being evaluated. So we don't try to wake them up fully on the scene because we really don't want them to refuse to be transported.
Pretty scary stuff. What's that like? I mean, obviously you probably see that. What is it like to see that situation where you might have someone who's completely unconscious, maybe not breathing on their own, and then administer? Typically, does it take one or two? And how do you do that? Is it something they inhale, or how do you?
Right. So first responders give it via the nose. Intranasally is what we call it. And we, as paramedics, we can provide it via an IV. It allows us to give smaller doses, allows us to wake them up slower. It provides a better outcome of the patient versus some adverse reactions to a lot of Narcan quickly. So what we see is yes, our patients aren't breathing, very blue in color. And if first responders have gotten on scene first, potentially when we arrive there, now they're talking to us. So we encourage highly to be transported to the hospital.
Definitely, because like you said, they need to be checked out by.
Right, because Narcan only lasts for approximately 30 minutes. So we sure don't want to leave somebody at a residence or a location and 30 minutes later they're back in the same situation they were previously.
Right, definitely. Now, as far as what you deal with when you have someone you've brought back and everything, give me your first, like, I guess your first person experience when you've seen one person go through that situation, and then you get called back to that residence again to see and bring them back once again. What's it like to deal with that situation? Because you probably encounter that quite a bit.
We do, as a matter of fact. And the odd part about that is sometimes we encounter multiple people on one location. It could be friends of each other, family members. In all honesty, it's almost sad to say, but it's almost frustrating on emergency responders' side of the house, because we know that we're there to take care of those that are injured or harmed or need our assistance. But we also know, too, that repeat offenders could take away our ability to help somebody else in a close proximity that needs us in a cardiac event or a stroke or a seizure. And if we're in a rural area tending to a repeat offender, something could happen in that same rural area and it creates a long response time for us. So it can become frustrating as a responder.
And how do you try to prepare for those situations? Because obviously in Montgomery County we have a lot of hills, a lot of rural areas. We're not all metropolitan just yet,
Sure.
but how do you prepare for that?
So we ask our paramedics, our units, and our supervisors to be aware of the calls, move assets into other areas if those zones are uncovered, to help preempt any calls that we may have while we're already tending to another emergency situation.
So good. It's a lot of, again, thinking ahead, and probably, I guess, you learn from where you go. Do you have any particular areas of the county that tend to be hot spots for this kind of issue, or is it
I think
all over?
I think it's pretty much all over.
It's all over.
Yes, ma'am.
How often have you found, because I know we addressed a little bit with Jimmy a few minutes earlier, law enforcement responding with you, are you typically getting there right as they're helping out? Because I know they have to be able to be trained to deal with Narcan too. Right?
Correct. So that's what's probably one of the huge reasons that we have armed the law enforcement and fire side of the house with Narcan, is because sometimes our response, whether it be our goal is 5 to 7 minute response time, but if we're making calls and we're busy and we're delayed getting to those patients, we know that fire and law has the ability to initiate that care. So we lean on those guys and girls to be able to help us with those particular patients, just in case we do have a lengthy response time.
And so you got not just yourselves who are really invested in these patients, but you've got law enforcement now too. Do you feel like this has created more of a teamwork kind of aspect for you?
Sure, not only teamwork, it's created work for us as well for responding to the patients, and then attempting to educate law enforcement and fire and the volunteer fire department. So we're having to educate those staff members as well on the administration of the Narcan. So yes, it's created a tremendous amount of work for our department.
And as far as, because I don't think everybody necessarily realizes, it's not just med calls that you're seeing this situation, right? You might be traffic accident. Can it talk to us through about kind of just the variety of different times and situations you've seen this happen?
Yeah, sure. So somebody driving by in a parking lot can see somebody slumped over a wheel, can see a vehicle on the shoulder of the road, and don't know what it is, but yet they call concern. So we can show up and find that this individual is potentially overdosed. We might not know that yet, but we're finding that more and more often that these people are seeing these people out in the general public acting strangely and calling 911, and we're finding that that's what's happened when we arrive on scene is they've overdosed on some form of medication.
And finally, Chris, can you kind of give us an idea of what the community can do? Because we know we've already got a lot of people invested. We got you in EMS. The paramedics are very invested. We got law enforcement. What can regular folks do to help deal with this issue of opioid overdoses?
Right. I think stay vigilant, educate themselves, read as much as they can. I think it's important to stay upon your medications, make sure your medication regimen is appropriate and doctor ordered. If you're concerned about your medication list, reach out to your physician. Ask them questions. I think it's important to be your own advocate, to make sure you're taking care of yourself. So just stay aware. That's what I'd recommend.
Great. Education is key, right?
That's right. Education is key. Yep.
Chris, thank you. Any other thoughts about where we're headed with this issue of the opioid issue, where obviously it seems like it's just steadily growing and growing?
No, I think it's just we as first responders need to be keenly aware of what's going on in our community. Stay educated, and stay aware of what's going on and be prepared to respond.
Definitely. Chris, thank you so much.
Thank
Chris
you for having
Proctor
us.
with Montgomery County EMS, and I'm Micah Terrell with APSU TV and WAPX-FM 91.9.